Philosophy of Nursing and Career Trajectory, presented by Karen Godzella for Nursing 370. Personal nursing philosophy involves treating individuals completely, as a whole. Some attributes that I feel are essential to bring forth into my nursing philosophy are kindness. Kindness matters every time, every interaction. Believing that I make a difference to a patient's day, to a patient's life. Advocating for the patient's wishes. Being competent, knowing the skills, thinking before communicating or acting, always learning, continue to enhance or to obtain new information and knowledge. I'm a knowledge seeker. Critically think and analyze. What might be presented may not indicate the complete story. Find evidence, ask questions, and seek answers. Be observant. Observe and analyze what I visually see, and observe the environment that surrounds my patients. Treat my patient with dignity and respect. Everyone deserves that. My patient has a history. Learn about that history. Be a teacher. Understand how to communicate and teach information to both the patient and their families. Listen with every sense that you have. Use eye contact, use silence, use touch, and be compassionate. My plan as I begin my career as a professional nurse is to work with and care for the geriatric population. I feel strongly that our elderly population should be heard. Their history is rich, and I feel they deserve respect and attention. Another path I would like to explore would be working with palliative or end-of-life care. In my experience, the avenues of the geriatric population and end-of-life crossed frequently. I often found, though, that discussions of death were shied away from, and often not addressed until it was very end stage of life. I am encouraged that the Institute of Medicine is actively working towards improved communication and care. Their goal is to provide coordinated, expert, compassionate care for people dying from chronic disease, which continues to challenge the American healthcare system. Reflection. When thinking about the material explored in this class, I think back to the beginning when we took a nursing survey about the traits of a nurse, and we identified with compassion and caring. But there's so much more to it, I've realized, and I have to take my complete self and better it through education and competence, professionalism, and give that to my patient so that their outcomes or experience can be the best it can be. An aha moment I just wanted to share from clinical last week was actually when one of my patients thanked me. I understood the words that she spoke, but my reaction brought me to pause. I felt like I was just doing my job, just bringing my whole self to the job and giving it everything that I have, because that's what people deserve. I don't feel my patients should have to thank me for doing that. It's my privilege to care for them. The history of nursing. In this course, we learned about the history of nursing with Florence Nightingale, starting the path that identified the nurse of today, or that of which we should strive to be, a nurse with a voice, a mission. I am optimistic that I will have a voice with local and national government with such issues as nursing shortages and professionalism. Evidence-based practice is what I will bring to my practice and to my patients through education and research. Using scientific-based evidence is critical to promoting optimal patient care. I feel identifying with the nursing theory is essential to understanding my own core values, my own belief system. A nurse has to know why they believe in something and how to affect an outcome when they practice nursing. I will discuss a theory that most appropriately reflects my beliefs later. Critical thinking is an integral aspect of nursing. I will use caution in my career to not accept something at face value. I will continue to evaluate the many possibilities. No matter how I have to get there, I'll be open to all possibilities. I will join a nursing association. I know I'll start with the American Nurses Association. I think it's important to enhance your professional and educational growth, as well as receiving support from peers. Also, there's a vast amount of resources that they can provide. In considering my nursing career trajectory, I will also explore nursing associations that are related to palliative and geriatric care. Just wanted to touch on debating. Through this class, I understand the rationale for debate. I was surprised to realize that there are valid concerns and positions on different sides of nursing topics. And I realized that if my mind is closed on the subject, it wouldn't allow for any further discussion or thought. And I bring this up because I understand that topics such as mandatory overtime and nursing shortages will be experienced in my career. The theoretical perspective that is most consistent with my personal nursing theory, as well as is relative to my aspired area of practice, is Dr. Jean Watson's human caring theory. Some aspects of this theory are to embrace altruistic values and practice loving kindness with self and others, being sensitive to self and others by nurturing individual beliefs and practices, develop healing, trusting, caring relationships, promote and accept positive and negative feelings as you authentically listen to another's story. I believe nursing is practice. It always has been. However, I feel a movement toward nursing as a discipline. Wikipedia defines a discipline as follows. A discipline incorporates expertise, people, projects, communities, challenges, studies, inquiry, and research areas that are strongly associated with academic areas of study or areas of professional practice. Nursing is its own specialty. It is the concentration of one academic field. Nurses work to achieve an outcome by working with a multidisciplinary team, and they are strong members of that. I believe considering nursing as a discipline requires social change, professional and some contemporary issues in the practice environment that I'll be faced with is professional image. But I believe the professional image of nursing will be moved forward, hopefully by changing the entry level of an RN position to have a BSN, with promotion of continuing education to the master's or doctorate level. This continued education will enable a nurse to interact professionally with other disciplines. Also, another issue that continues to be of concern to me is the judgment of males. When they are choosing a nursing career, they're choosing a caring profession, and no matter if you're male or female, I think it takes a really special individual to do that. I am hopeful that this prejudice will diminish and allow more males to choose freely the nursing profession. Nursing leadership. As a nurse, I will be involved in political campaigns. I will start my career when the Affordable Care Act has just been realized, with the implications of providing health care to more people, increasing the demand for nurses, advanced practice nurses, and nurse practitioners. For changes in healthcare reform to be fully realized, it will require me to be a leader in the process and to find others who will share and support my goals. In 3 years, the way I'd like my patients to describe me would be that she's diligent, caring, kind, thorough. I would like them to say that I always have time for them. I want my patients to be aware that I pay careful attention to detail and that I will monitor and continue to assess if even something is just slightly different than normal, and I will seek to find out the answer why. I think I would be happy, though, if my patients would describe me as follows.
In 3 years, the words I would like my patients to use when describing me would be, she sees me, she knows me, she cares about me, she fights for me, she makes me smile, she makes me laugh.